Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emran. On today's episode, I have two very special guests. I have Thomas and Vicoria. These are students who are interning on my program, and they have some questions today about some health issues. So Thomas, tell me about the question or the scenario that you had.
Okay, so this is a really cool factoid that's really relevant to this conversation. And according to a study done by the Centers for Disease Control, 1 in 3 adults in the U.S. have hypertension. So we know that's really common. And so now the main person in this case study is my uncle, who is 45. And he lives a rather healthy lifestyle. He exercises daily and has a healthy diet and hasn't really had any other previous adverse medical conditions before this. And so the main disease that he has right now is hypertension or high blood pressure.
Okay.
So first, could you explain what hypertension is?
Absolutely. And I'm glad you referenced the CDC. So the CDC is the Centers for Disease Control. It's actually based in Atlanta, Georgia. So that's kind of like the federal health department, if you want to think of it that way. So normally they track things like infections and diseases, but now high blood pressure is actually the most common disease in America. And heart disease is the number one cause of death in most adults. So what you're referring to is that 1 out of 3 adults has high blood pressure. So first we have to define what high blood pressure is. The medical term is hypertension. And so hypertension is based on 2 numbers. The top number is the systolic, which is the highest number, and the bottom number is the diastolic, which is the lowest number. So the way to think about that is that when you have a heartbeat, the pressure will increase, and that highest peak is going to be the systolic. And then in between the heartbeats, there's a small pause. That's the diastolic. That's kind of like the resting pressure in between. So that's what high blood pressure would be, or hypertension. Now, in the case of your uncle, it sounds like he went to the doctor just for a routine sort of a checkup, and they checked his blood pressure. Do you know what the numbers may have been at that time?
I saw that he told me that it was around 200 over, and then I forgot the
No problem. So he went to the doctor, was feeling fine, had no complaints, and they checked it. Let's say it was 200 over 110. So that's definitely high. So the CDC and most of the other national guidelines, the perfect number they always talk about is 120 over 80. So 120 over 80 is considered the gold standard. Now some people could be at 130, some people could be at 140, and then it's really when you start to go above 140 that you really have a diagnosis of hypertension that you have to treat with medication and lifestyle changes. If it's a number of 200, that's high. That definitely means that treatment is necessary. Now, tell me about your uncle. You said that he has a very healthy lifestyle. Is he overweight? Does he have any health problems that you're aware of?
Just from the looks of it, he looks pretty healthy. He's quite slim, like around 6'3".
Okay.
And previous medical conditions, not that I know of.
Excellent. All right. So it sounds like he's taken very good care of his health for all these years, but something may have changed. And so we almost have to go backwards a step. So when people come in with high blood pressure, no symptoms, and they have no obvious cause, I always ask about their family history. So genetics are the number one predictor of high blood pressure. So if your mother or your father or your brother or your sister have high blood pressure, your risk goes up. So you have now a 50% risk of developing it. And so my suspicion is that one of his close family members already had high blood pressure at a very young age. Now, the second thing that we worry about would be anything with the diet. So even though he eats well, it's possible he may be eating too much salt, or he may be on vitamins or supplements or something over the counter that could be causing the high blood pressure. Now, your doctor goes through all that in detail when they're asking questions. If they cannot find a source for it, then even though we don't know the answer for why, we have to treat it. Otherwise, high blood pressure, especially over 200, is going to cause some major problems. So do you know which parts of the body are affected by high blood pressure? Why do we really want to treat the high blood pressure?
So there's the kidneys, which filter out the blood and make sure that all the toxins are taken out and new blood is replaced. So that's really important to keeping up your body's homeostasis. Could you explain how high blood pressure can be adverse to this?
Absolutely. So the kidneys are very, very critical in circulation and homeostasis. Homeostasis is the body's way of keeping healthy, maintaining the pulse, maintaining blood pressure, maintaining the temperature, maintaining metabolism. These are all parts of homeostasis. The kidneys actually like high blood pressure because it ensures that they get an adequate supply of blood in order to filter. The problem is that too high of a blood pressure will cause damage to the individual cells, and that's why we actually have two kidneys instead of one, because they're that important to the body. Over time, the kidney becomes damaged permanently, though. So if the blood pressure stays at 200, after a few months, it's actually going to cause protein in the urine, and that will lead to other complications. So people who don't treat high blood pressure can end up in heart failure, kidney failure. These are all linked directly. Absolutely. Which other parts of the body do you think are affected by high blood pressure?
So high blood pressure is a problem that affects your arteries and veins. So of course the brain has to be affected because it lies above the heart, and the heart has to pump hard enough to fight the effect of gravity to be able to have the blood to reach the brain.
Absolutely. So the brain, which is physically above the heart level, requires a certain amount of blood pressure just so that the heart can pump upwards and allow an adequate supply of blood to the brain. And what we worry about with the brain is that if there's either not enough blood or if there's bleeding in the brain, that's called a stroke. Okay? And there's two different types of strokes. Do you know the different types of strokes?
I sadly don't know.
No problem.
It's
So
ischemic and hemorrhagic.
Excellent. Okay, so ischemic and hemorrhagic. Those are two types of strokes. So ischemic means that there's been a blood clot that occurs, and so the blood cannot flow past that point, and the brain tissue dies. Everything downstream from that point will die permanently. The other one is called hemorrhagic. So hemorrhagic occurs when the blood vessel, the vein or the artery, actually tears or it bursts. And now with every heartbeat, blood is leaking into the brain. So these are two completely opposite scenarios, but they both have the same end result, which is stroke, permanent loss of function of the brain, and if it's not treated, it will cause death. So that's really why we are so focused on high blood pressure, and we call it the silent killer, because most people, if you check your pulse or your blood pressure right now, you make a guess before you check it, you're probably wrong. It's because you can't tell your blood pressure just by looking at someone, you can't tell it by looking in the mirror. Some people feel bad when their blood pressure is too high or too low, but you can't actually put a number on it until you check it. So the most important step is to check your blood pressure at least once a day, especially if you're worried. If it's normal, that's great, but if it's high, you need to monitor it very, very carefully, certainly. And then we talked a little bit about, off air, we talked a little bit about some of the medications. So are you familiar with different categories of medications that can be used for high blood pressure?
I think for the most part, I know a common medication is lisinopril, and if it's too high, then they prescribe clonidine.
Okay,
Is that right?
Very good. So there are so many blood pressure medications in the United States and worldwide because each person is different. So if there was one medication that could treat blood pressure for the whole world, that would be a simple answer. But the causes of blood pressure are very different. So the one that you mentioned, which is lisinopril, is one of the most common ACE inhibitors. So an ACE inhibitor is a blood pressure medicine that works at the kidney. So it turns off a switch which keeps the blood pressure actually normal, and it protects the kidney from damaging itself. So ACE inhibitors are one special class of blood pressure medication. Another class, as you mentioned, is clonidine. Clonidine is called a centrally acting medication. This one actually works at the brain and the nervous system, but it's very, very strong. And so a tiny dose of clonidine can drop the blood pressure almost 50 points. That one's usually something we use a little bit later. There's a few other categories of blood pressure medicine. One is called a beta blocker. So a beta blocker slows down the pulse rate. So for some people, if they check their pulse when they're just sitting at home watching TV, it's very, very fast. And so if your pulse is 100 or 110 and your blood pressure is high, it makes sense to take a low-dose beta blocker. And your blood pressure gets better, your pulse gets better, and people actually feel better overall. And then another category would be the calcium channel blockers. So calcium is necessary for muscles in order to contract, and the heart is composed of special muscle. And so calcium channel blockers also work to reduce the blood pressure, and it's very effective. Some people may need just one medication, others may need a combination. So they may have to take 2 or even 3 blood pressure medicines to bring it down, all with the goal of preventing stroke, kidney failure, heart damage, and some of the other complications. So that's why there are so many different types of blood pressure medications. Okay, good. What other concerns or questions did you have about your uncle with the blood pressure?
So what I'm mainly worried about is, are there any like extreme health implications that can occur if this is left untreated and they live with it?
Absolutely. So people who ignore their blood pressure, or if they don't follow their doctor's instructions, they are setting themselves up for failure, because there's no real natural way to control blood pressure unless you do all those things that we talked about, which is watch what you eat, maybe exercising, going to your doctor for regular checkups, and medication. The problem with the blood pressure is that if you leave it unchecked, it will worsen, because it's going to cause end organ damage, which we talked about with the brain, the heart, the kidneys, even the eyes can be affected by high blood pressure. So it's something that we take very, very seriously. And in the hospital or in the emergency room where I work, we are required to check the blood pressure first before we do anything else. And then we're required to check the blood pressure when they're discharged. So before those people go home, even for a sore throat or for a rash, we actually have to check the blood pressure twice. So first when they come in, and then the second time when they leave. And if it's high, we are required now to give them a referral or a business card to a local doctor, because we're trying to prevent complications down the road. And as you mentioned earlier, 1 out of 3 Americans has high blood pressure. That number is going to increase, and we have to be very vigilant about that to prevent complications across the country. Definitely.
So I have a question. If the body wants homeostasis, right, why isn't there a way for the body to fix itself and to lower the blood pressure?
Absolutely. And that's a good point. So the blood pressure changes minute to minute. And so we have different functions in the body that are competing. So as I mentioned earlier, the kidneys want high blood pressure, the brain wants high blood pressure, but the veins and arteries can't sustain it. So just like your skin, if you think about it, if we are 50 or 60 years old, we work out in the sun all day, we naturally get wrinkles and the skin elasticity is lost. The same thing happens in the veins and arteries. So once they get to a certain point, the veins and arteries can't contract and pulse in a healthy way, and so the efficiency is lost. So it's cumulative. It doesn't happen in one day. People don't develop high blood pressure overnight. It's a process, and it takes months or years for it to develop, and to resolve it, it's very difficult without medication.
Right.
Absolutely. All right, very good. Other final thoughts or concerns?
So this is my last question.
Sure.
So this is somewhat unrelated to this case study, but I read somewhere that smoking is a common cause of high blood pressure. So could you explain how that is?
Absolutely, and I'm glad you asked about that. So smoking, as you know, is a very common, it's an ancient tradition. People smoke different forms of cigarettes and cigars or hookahs or hubble bubbles, all kinds of stuff. And the problem is that the chemicals in the smoke actually cause vasoconstriction. So it causes the veins and the arteries to actually clamp down, which is what causes the high blood pressure. And you can always tell a person who's been smoking because their skin actually looks a little different. Their face is a little bit drier, their tone is a little bit different, and that's because of the chemicals that are in the cigarettes as well. So the easiest thing to control your blood pressure, if it's related to smoking, is to give up smoking. But smoking is an addiction, and it's very, very hard for people to quit. It can take 3 or 4 attempts before people give it up altogether. So it's one of the hardest things in the world to give up, but you're right, it is directly linked with high blood pressure for that reason. Excellent. All right, other thoughts?
No.
All right, very good. Well, this was a great topic. I'm glad that we discussed hypertension along with some of the other medications that we can use to treat it and some of the complications. We'll have a show notes and a blog page to reference all the information that we talked about on today's episode. So I want to thank Vicoria and Thomas for being on the show today. You can follow us online at simplehealthradio.com. Our show is available on iTunes, iHeartRadio, and Spreaker, and I look forward to having you on a future episode.